Administering an intramuscular injection using Z-Track method. Check physician's order and assemble equipment. Calculate the correct dosages. Wash your hands. Prepare ordered medications correctly using appropriate syringe and needle combination. If using medication dispensed in a pre-filled cartridge, for example a Carpujet, add appropriate gauge and length needle. And correctly expel the excess air while holding the syringe in an upright position. And then by wasting the excess solution while holding the syringe in a dependent position, pointed downward. When adding a medication to the Carpujet from a unit dose vial, for example atropine, clean the rubber top of the vial with alcohol wipe. And draw up correct dosage of medication ordered. There is no need to add air to a unit dose vial. Change the needle using aseptic technique. This ensures that no medication is in or on the needle, which may irritate the tissues when inserting the needle. Label the syringe. We will begin this procedure by demonstrating the 3 IM injection sites, beginning with the dorsal gluteal site. You will need to choose and identify the intended injection site, including the bony landmarks and the name of the muscle. For dorsal gluteal, first locate the greater trochanter. Place your index finger or fingers on the greater trochanter. Find the posterior superior iliac spine. And you put a finger or two on the posterior superior iliac spine. Now draw an imaginary line between these 2 landmarks. In the middle of that imaginary line, you're going to go up about 1 inch, and this is your intended injection site. Now we'll demonstrate the ventral gluteal site. You'll locate the anterior superior iliac spine and the greater trochanter. So you put your index finger on the anterior superior iliac spine. Your palm will kind of fall down the vicinity over the greater trochanter. Then you're going to spread your fingers back towards the iliac crest. Your injection site will be in the V. Please note that when using the right hip, you use your left hand to find the injection site, and if you're giving the injection site in the left hip, you would use your right hand. You'll demonstrate the vastus lateralis. For this, you need to locate the greater trochanter and put your palm on the greater trochanter and the patella. Put your other hand on the patella. You want the anterior lateral aspect of the thigh. So you don't want the side, you don't want the top of the thigh, you want in between, and the anterior lateral aspect. So your injection site will be right here at this angle. At your patient's bedside, performed hand hygiene, verify correct client, explain procedure to client. Apply non-sterile gloves. Loosen but do not remove the needle cap and lay syringe in a safe place, such as the overbed table. Choose and identify the intended injection site. We will be using the vastus lateralis. You first will locate the greater trochanter Put your palm on the greater trochanter and locate the patella. Put your palm on the patella. And then you need the anterolateral aspect, which means not the side of the thigh, not the top of the thigh, but in between. So your injection site would be right here. You need to assess the site of choice and assure the area is non-tender and free of lumps, nodules, scars, or bruising. Do not use an extremity with potential for lymphedema. Use your non-dominant hand to displace the skin laterally by pulling it 1.5 to 1.5 inches away in any direction from the intended injection site. It is important to not release the displaced tissue until after the medication has been injected and needle is removed. With your non-dominant hand, cleanse the intended injection site thoroughly with an alcohol wipe. You will use a gauze pad in the lab, in a bullseye motion working outward. Keep your non-dominant hand in place to maintain tissue displacement. Remove the needle cap without contaminating the needle. Do not allow the cap to fall into and remain in your patient's bed. Hold the syringe in your dominant hand between your thumb and your forefinger like a dart. Quickly dart the needle into the tissue at a 90-degree angle. While continuing to displace the skin with your non-dominant hand, aspirate by slowly pulling back on the plunger to determine whether the needle is in a blood vessel. If blood is aspirated, withdraw the needle from the tissue and discard the syringe and prepare the medication in a new syringe. If no blood is aspirated, inject your solution slowly. Hold the needle in place for approximately 10 seconds to allow the medication to diffuse through the muscle. Then quickly withdraw the needle. Then lift your non-dominant hand to release the displaced tissue, allowing the tissue to return to its normal position. This seals the medication within the muscle layer it is intended to be delivered to and does not allow the medication to track backward into the subcutaneous tissue, causing irritation and changing the absorption rate. Apply gentle pressure to the injection site. Do not recap your used needle. Activate your safety shield. Discard the needle and the syringe in a sharps container. Assist your patient to a position of comfort. Wash your hands. And then document. Documentation would include
date, time, signature, credentials.
Medication given, dosages given, not volume, route, injection site, and teaching learning response.